I'm a biologist, and my colleague here, Sheila, is an artist and art therapist. And we used our combined skills to introduce the students to a novel way of learning, which is Showcase a Cell. So the students were encouraged to come along to some voluntary workshops to identify some of their bioscience problems, and we used art materials, or provided them with art materials and some guidance and assistance to help them express their biology learning using art as the main medium.
So through our art-science collaboration, we wanted to increase the motivation of students and to turn around their resistance and aversion to learning to a more confident learning approach.
Well, this was an assignment that we had to put together, and I would say I want to give all the thanks to this pretty girl because she actually brought all the ideas and then everything, and we just sat down one day. She told us what to do and then just put things together, and here we are competing for a prize in Health Got Talent.
So basically our assignment was about showing sort of an individual's journey through their mental health illness, but from a carer's perspective, and just how important that carer's relationship with the service user is in terms of the service user's recovery and the prognosis for the future.
Well, it's a creative way to introduce library resources to the first year nurses and midwives. So we used a variety of storytelling and quizzes to enhance, I guess, the resources, the introduction to the resources.
Yeah, tried to make it a bit more practical as well. So we had filmed a video with myself as a pirate captain,
Yeah,
as a nurse,
Point.
to introduce
Pirate
the pirate theme of a treasure hunt, and then set them off with an interactive quiz that they could use online.
Yeah.
To discover more about our library
Yeah.
resources and introduce them for the first time.
Yeah, hoping that if they'd had a good and positive experience with the library, then it might help them to engage earlier and then make their whole library journey through their degree easier.
Okay. My name's Alan Simpson, this is June Hanshaw and Jay Hudson. We work together providing a workshop on working with carers in mental health.
We advise the new students of mental health nurses on what it's like to be a carer, the issues that we suffer, and how the triangle of care helps in the recovery of our loved ones.
Our approach is lovely, it's nice and unique. We have true co-production, myself and June are colleagues with Professor Alan Simpson. We teach on the triangle of care, all aspects for the mental health student nurses on engaging with and working with carers in their practice.
We use a range of methods. We use role plays, videos, information about policy and law and practice, and it's incredibly well evaluated and well liked by the students.
So my name's Jessica, this is Wahida, and we presented the SHS Work Hub today, which is a platform which we've developed for both academic and professional members of staff, which is based on SharePoint. So it's a one-stop shop, a centralized location for all guidance for staff.
And the idea is to make the life of a program officer or a program director much easier, so they can it helps them do their job in a much more planned way, structured way. So that's the purpose of building the hub, and we're hoping to build on it and create more features so staff can start, making full use of it.
So it's quite innovative in its approach, and we're looking forward to seeing the potential for it can go.
It has received really great feedback, so we're hoping we can develop more on it.
Definitely.
Yeah.
Okay, so today we talked about CityTex, which is a technology-enabled care studio that we've developed in conjunction with City Health. It's a home environment which is kitted out with the latest technology, so telehealth, telecare, telemedicine, telerehabilitation. And we use it to introduce students to these technologies so they can get hands-on experience of using it. Also, the environment is videoed up, so as they're using the technology, you video them doing that, and other people are watching in a different classroom, seeing what they're doing, how they're interacting with patients and the technology, and then they can take that feedback with them, so take the video recording with them and reflect upon that. So it's a nice environment where you get experiential learning, you can use a higher level of analytical and critical skills, and hopefully it will teach them a bit more about how to use technology in their service provision.
So within healthcare, medicines management is a really important aspect of care. And we want nurses to be able to know what medications they're giving, why they're giving them, to do drug calculations, and also we want to be able to reduce avoidable harm. So we decided that we would develop a good old-fashioned board game to help them do that.
This board game looks like Snakes and Ladders, except what you've got is that the questions are made up of general medication questions, but also we have calculation questions. So if the student lands on pills, they'll be asked a calculation. We've also got straws and syringes rather than the actual snakes and ladders. But it's a really good way to have some creative engagement for our students and shared learning.
And they get very competitive.
Okay, yeah, the students find audit really difficult, and they writing SMART goals, so very specific, measurable goals. So we actually got the students out around the university and just around in the streets doing an audit in practice. So they had to think about how to set up the audit, how they were going to do it. They actually put it into practice, came back and presented the results, and then thought about how they were going to deal with a very specific objective. And then with that objective, they were going to put that into action and re-audit later. So it's a transferable skill that they can use in their practice. And students actually said it really helped them to be, audit was less scary, and that they realised they could audit anything.
Cityscape is a video-rich, interactive multimedia piece that is designed to be used in a 3-hour session with small group work to replicate time in practice.
Okay, so Cityscape is inclusive by design, so it's been designed to incorporate various different learning styles of students. It's also inclusive to the fact that we worked with actors who had learning disabilities themselves, and they were part of the design of the project. And it's also inclusive because we worked with students themselves who were actors in our videos and our scenarios, but also helped to consult us on the project as well. So what we've done is we've created a series of videos that break down into chapters that have various different electronic online interactions. So things like thing link diagrams, quizzes, those kinds of things, and it all lodges into Moodle. And then the session takes place in AG24, so students interact with it online, and then they put the computers down and they write in their books, and then they also have discussion as well, so it formulates a full sort of blended learning approach.